afternoon, everyone. My name is Masha, and I am a postdoc in Native Proteins Lab. And I'm going to talk about some of the projects that we are doing in addition to what we do essentially with our movement disorders patients during the intra-op phase of their DBS implantation surgery to understand the disease. And these are our multidisciplinary projects that we're trying to define aside to those main projects. The first one is to basically try to see if we can use the opportunity of accessing subcortical structures and simultaneous recording from the cortical surface through an ECOG strip that basically sits on the frontoparietal cortical surface through the bear hole and try to understand how during general anesthesia dynamics of the brain change. So existing theories about general anesthesia is that basically they're coming from invasive animal studies or some of the invasive animal studies and EEG in humans and some modeling work. But direct recordings in human are rare due to obvious reasons. With our team in the neurosurgery, anesthesiology, and psychology, we are trying to record simultaneously from the DBS leads that are inserted in the basal ganglia. This is a GPI example, for example, and the cortical signals. And we have been trying to understand the concept of anesthesia. Our preliminary studies basically show that there is a reduction in functional connectivity across the sensory and motor cortices and between the thalamus and the sensory motor cortex. And some of our results have been published in anesthesiology, and the most recent thalamocortical work is under review in brain. The other projects that we're trying to follow is encoding of movement kinematics in brain signals. So astonishingly, human movements obey very certain kinematic laws. And these kinematic laws are shown to be preferentially encoded in brain during both action observation, mirror neurons, and also during execution of movements. And we all know that movement is encoded at multiple levels of nervous system, and imaging studies indicate very specific role for basal ganglia. But the current literature is limited because there is no real-time access to the ongoing movement while we record simultaneous brain activity. And we can record as multiple levels during movement, like cortical and subcortical areas. And we directly compare between tasks, like we either study action observation or action execution, but not both. So we're doing two different projects. The first one is in collaboration with Dr. Susana's lab. We are doing mobile EEG and motion capture, and we're trying to understand what happens during gait in Parkinson's disease patients, especially because they have always some sort of gait disorder. Now we're moving toward easier devices that are comparable to motion capture, and these are APDM motion sensors that basically are wirelessly transmitting movements and signals, while we can also wirelessly transmit brain signals. Our future studies will basically focus on direct comparison between action, execution, and observation during drawing and watching of movement traces in collaboration with Dr. Flash in Israel. And we're going to move on to a chronic phase with the Medtronic RC+S that basically is a sensing neurostimulator. We're going to implant these patients, we're going to have them come back to the clinic, and we're going to do monitoring of their basal ganglia activity and mobile EEG while they do various movement tasks. Thank you very much. That was the question.